So we are going to talk all about the vagus nerve today, and hopefully you guys will learn some new things, and hopefully there'll be some things that you've never thought of. I brought some things in that I thought you might not know about the vagus nerve. So we're going to talk about this one nerve that controls everything in the body, whether we feel safe or stressed. Just sorry, I just wanted to make sure I was still recording this. Um, and we want to know, like, exactly how does this vagus nerve connect? It is the body's entire safety switch. And so by the end of the talk, we're going to have three simple tools that you guys can use tonight, whether you have a device or don't have a device. And we're going to have you do things that or give you tools that you can use in case you feel completely stressed, or how do you feel calmed? How do you use things to stimulate the vagus nerve that you can do at the drop of a hat? So we'll give you all kinds of tips like that as well. So I want everybody to just take a couple of nice deep breaths. We'll do this together because this helps calm our vagus nerve. So we want to inhale on the count of 4, exhale on the count of 8. And we're going to try to do this for just 3 times. So we'll inhale 1, 2, 3, 4. Exhale 1, 2, 3, 4, 5, 6, 7, 8. Don't worry if you run out of air before you get to the 8. Just try to take a deeper breath each time you do that. So inhale 1, 2, 3, 4. Exhale slowly 1, 2, 3, 4, 5, 6, 7, 8. And then we'll do it one more time. Big deep breath in slowly 1, 2, 3, 4. Exhale 1, 2, 3, 4, 5, 6, 7, 8. So I want you, while you guys do those things, to just kind of notice what happens with your heartbeat, what happens with your shoulders. Do you lift your shoulders up to inhale? Do you exhale and let them down? Are you feeling stressed? This is a technique that you guys can use whenever you're starting to feel a little bit stressed or a little bit nervous or anxious, and it'll help calm that vagus nerve down. So it's a very simple thing that you can do. It's great to do at the stoplights on the way home, just to get you relaxed and get you moving in the right direction to get home. So the vagus nerve is your body's superhighway. It is a long super wire from your brainstem to your neck to your heart, lungs, and stomach. And it is the 10th cranial nerve. So it connects all of our major organs to the brainstem, and it runs down both sides of the neck and branches out into the heart, the lungs, the stomach, and the intestines. And this is where I think it can really blow people's mind, is that 8 out of 10 of the nerve fibers in the vagus nerve carry messages from your body, from the body up to the brain, but it doesn't go the other way. It doesn't go from the brain down. It goes from the body up. And that means your body is constantly texting your brain about what's happening. So your gut is literally sending thousands of signals per second to the brain about whether you're safe or not. And that's why the gut changes our mood so quickly. So if our gut is off and we're feeling nauseous or sick, or you have an anxious stomach, and you have nerves in the stomach or butterflies in your stomach, that's sending that message back up to the brain. So it's really important for us to have a healthy gut to send the message to the brain, because it doesn't happen the other way around. All right. So what does the vagus nerve actually do anyway? Well, think of it as your body's brake pedal. When it's working well, it slows down your heart. So after you have a stressful event and your heart's racing and you're a little nervous, that vagus nerve calms our heart down. It makes your breathing easier and slower, and it helps our gut to digest food properly. So we have less nausea, less bloating. And there's something really cool about the vagus nerve. It can actually tell your immune systems to calm down and reduce inflammation. So when the vagus nerve is strong, you recover faster from stress and illness, you breathe easier, you digest better. and overall we have less inflammation. When that vagus nerve is weak, we stay stuck in stress mode or fight or flight mode. We stay stuck in that racing heart, the shallower breathing, our gut issues stay present, and you have that wired but tired feeling that so many people know very, very well. So the vagus nerve is also called the polyvagal theory, and it's a simple way to understand how your nervous system works. And we all move through these three states every day. Green is our safe and social. This is where our healing happens. When you're calm, you're connected, you're thinking clearly. Your vagus nerve is strong here. Yellow is when we're in fight or flight. Your body's ready to mobilize, to fight, or to run. And the vagus nerve is feeling a little stressed here. Your heart's racing muscles are tense. You're focused on threat. And red is where we're freezing or we're completely shut down. When danger feels totally inescapable and your body shuts down to protect you, you feel numb, you might feel heavy or foggy, like you can't move or speak. Think about if you were in an accident, maybe there was a death in the family and it was super traumatic at that moment for you. You're kind of in freeze and shut down at that point. You can't really think clearly. You can't really put a sentence together, things like that. Now, here's where it gets to be key. Our health isn't about staying in the green 24/7 because that's impossible. We're exposed to stress all day long. What's really important here is having the flexibility to move through these different states and then return back to the green. So if we have that flexibility, that's what we call vagal tone. And the good news is we can actually train our bodies and train that nervous system to have that vagal tone where we can come in and out of fight or flight, back into safe and social, into freeze and shut down, back into safe and social. We don't have to always be stuck in fight or flight. And even though there may be a lot of stressors going on that's putting us in fight or flight, our body doesn't have to feel like that. We can go back, retreat, rest, repair. So vagal tone is like your fitness score for your nervous system. If you have a high vagal tone, that means you bounce back from stress pretty quickly and you can go from yellow and red back to green very easily. If you have a low vagal tone, that means we're getting stuck and you're staying in that fight or flight. You can measure this with something called HRV, heart rate variability. And it basically shows us how much your heart rate changes from beat to beat. So high heart rate variability is good. It means your heart rate is flexible. You can bounce up to 150, come back down to 60 or 70, bounce up to 100, come right back down again. That's a really good flexibility. When you have a low HRV, that means you're stuck in stress mode. But don't worry about the exact numbers yet, because that's just a small part of these daily habits that changes that. So people who have their heart rate that goes up during a stressful time and stays up for 4, 5, 6 hours, even if it's at 90 or 100 or 110, that's not a good place. We don't want you to be in that. But we want to be able to track those trends. And it's about those trends of you seeing like, okay, this was a stressful time for me. My heart rate went up, but it came back down again. And I was in that rest mode. Okay, here's another stressful time, but it didn't go up as high. The more we improve the vagal tone, the better our heart rate variability will be, the faster it will adapt to those stressful times. And we're going to talk about specifics that you can use today to help with that heart rate. So this is something wild that most people don't really know, that your gut has special cells that scientists call them neuropod cells. And they form almost like a synapses, like a connection with the vagus nerve. So think of like a separate wire that goes to the vagus nerve from the gut. And they can send messages to your brain in milliseconds, faster than you can consciously think. And that's why a heavy meal makes us sleepy almost immediately. That's why too much sugar gives you that wired feeling and then you crash. Your gut's literally texting your brain thousands of times per second about what's happening in the gut and what's happening with the nutrients, about the stretch, and about whether things feel safe or dangerous. So this is the gut-brain axis in action. And the vagus nerve is the main highway. So when people say trust your gut, there's real science behind that. Your gut feelings are actually nerve signals. So if you have a food sensitivity and you're continually exposing yourself to that food that your body is not really loving because it's triggering the immune system, the proteins are getting out into that immune system, it's causing the immune system to go haywire. It's sending that message back up to the brain that, hey, things aren't good here. I'm not feeling safe. I'm not feeling like my gut is in a good place. And then that puts the rest of the body kind of on alert as well. So another amazing thing about the vagus nerve is that we never hear about is that it's a built-in anti-inflammatory reflex in your body. When the vagus nerve is active and it's strong, it sends signals that tell your immune system to calm down and stop producing so many inflammatory chemicals. This is measurable, and we can see it on blood tests, like a C-reactive protein will show us your inflammation marker. And this is one reason why we practice slow breathing, good sleep, and gentle movement. All of these things can actually improve your lab work so that those inflammatory markers are not so high. It's not just a woo-woo placebo thing. It's actually real physiology. Chronic inflammation is at the root of so many problems: pain, fatigue, brain fog, autoimmune conditions, heart disease. So when we strengthen the vagus nerve, we're literally helping to cool the flames of the inflammation in the body. And this is why the vagus nerve has gotten to be so important as we've learned more and more about it. Now, in cases where there's been trauma and stress, because this is where a lot of people get stuck, when you face danger, your brain tells your adrenal glands to dump cortisol and adrenaline into your system. And that's normal and it's helpful. Tiger comes out, we're running, adrenaline is kicking up, we're hiding, right? Car pulls out in front of you, you slam on the brakes, everything kind of gets a rise, cortisol gets pumped out in the body, and we look around, everybody's okay. We kind of keep moving. That's normal in the short term, and it's helpful because it gives you energy to fight or run. But if that threat often feels inescapable because there's trauma or chronic stress, if you can't fight and you can't run, your body then goes into freeze. And that's when you shut down, you go numb, you have heavy quiet. Unfortunately, a lot of people learn to live in this cortisol freeze response on a daily basis, either from trauma or chronic stress. And the body can't tell the difference between good stress and bad stress. So there could be stress in planning a wedding or a baby shower, or it could be the stress of planning a funeral. The body can't tell the difference between that. So even though it's happy stress, you've got a baby coming, someone's getting married, those things are still stressful to us. So if we constantly stay in that stressful state, we never retreat back. We never calm our nervous system. We never allow it to relax and rest. And we stay in that chronic stress state. The vagus nerve starts to feel that because our daily cortisol rhythm, which should be high in the morning and low at night, can go flat or even flip. It can be high at night and low in the morning, and the body doesn't know what to do with it. So we start to be running with cortisols either at the wrong times of day, like a baby with its days and nights mixed up, or we run flatline because we've kind of burned out all that cortisol and we don't have enough of it to get us going again. And when we don't have enough and we're running too low, the vagus nerve puts on its brakes and it gets weaker and weaker. And that's why trauma survivors often have really low heart rate variability and feel stuck in that yellow or red state. The good news is we can rebuild that and break with safety cues, breath work, sleep, connection, and vagus nerve tools that we're about to go over that can really help us with those things. Okay, so we're going to get into some fun stuff now. And these are the things nobody tells us about the vagus nerve. First, if you've ever cleaned your ear with a Q-tip and suddenly felt like you needed to cough, that's because there's a small branch of the vagus nerve in your ear canal, and it's called the Arnold's nerve. And when you stimulate it, you can trigger a cough reflex, and in rare cases, even make people feel faint. There are also some fun hacks here that you can actually use to get the vagus nerve to kind of be tricked into working. One of the things is the cold face trick. So if you put cold water or an ice pack on your face, especially on the cheeks and the forehead, for only about 30 to 60 seconds, it triggers something called the diving reflex, and your body thinks you're going underwater. So it automatically slows your heart rate down to conserve oxygen. So if you're feeling like your heart rate is elevated and it's high, and if you wear an Apple Watch or an Oura Ring, and you can check your heart rate on that, you could walk into the bathroom, splash your face with some cold water, and that will immediately bring that heart racing down and bring that heart rate down. This is incredibly effective for panic attacks or when your heart is racing. If you've ever had a child that holds their breath when they're angry, and somebody says, put their face under the cold water, just run cold water on their face because they'll take a breath, that's what's actually happening. It's triggering them automatically. So feel free to practice this later. It's kind of fun. We do it a lot in the summertime when it's hot, but we don't think about doing it in the wintertime when it's cold out. You could also in the wintertime go outside and just let the cool air go on your face a little bit, and it does the same thing. So we're going to talk about something now that surprises even doctors, and very few doctors know anything about. There's a small bone in your throat called the styloid process. And in most people, it's a very short bone and it's out of the way. But in some people, studies show about 4 to 10% of scans, it's longer than normal because it becomes calcified over time. And then when it becomes calcified, it becomes longer. And it can become long enough that it can press on the vagus nerve or near the carotid artery or the jugular vein. So that's right on the side of your neck here. Now, most people with a long styloid have zero symptoms, but when people do have symptoms, it shows up and it can be really confusing because you can have chronic throat pain, chronic ear pain or pressure. You can have voice changes. You can have dizziness, especially when you turn your head a particular direction. And some people may notice it if it's upright versus if they're laying back. That turning of the head, if the styloid on that side of the neck that you're turning to is too long, it presses on the carotid artery, on that jugular artery, and it doesn't allow you to get the blood flow back up to the head properly or oxygen up to the head properly. We see this happen if people have had neck trauma or head trauma. So kids that were in gymnastics or in football oftentimes can have neck injuries that nobody really notices, or it just gets looked at and they're told it's fine later. And over time, you can develop slippage in that spinal column from the joint or from the discs itself, and the muscles getting weak, and it's called a laxity, cervical instability. And that cervical instability allows those bones to shift back and forth. And as it does that, it allows these styloids to calcify and grow. And they almost look like a stalagmite. If you've ever seen that in a cave, they kind of look like a tooth, like a big honking tooth coming out of the neck. It's pretty interesting how they see that. And it's called Eagle syndrome. It is thought to be rare, but 4 to 10% of the population is pretty large. And if you're suffering from chronic issues like dizziness and headaches, vertigo versus dizziness, balance issues, the headaches are usually a big problem for people with Eagle syndrome. That lightheadedness, dizziness when they bend over to standing up, changing positions, having problems at night when you're sleeping, when you're laying on one side versus another, because if it's pressing on one side versus the other, that will cause significant issues. So for people who have those types of issues, it's worth asking to have a scan done. You can do a CT scan and we can evaluate the length of the styloids. And if the styloids are elongated, then there's additional tests that need to be done to see if they're pinching on the carotid artery and if they're causing a blockage in there or not. And it's not like a typical blockage we would see with the carotid artery. The only time you typically see it is when that neck is in motion. You don't usually see it if the neck's in one place, which is how we do almost all of our CT scans. So it makes it a little bit of a challenge to see that. Another thing that we want to talk about with the vagus nerve is because it runs right next to the blood vessels in your neck, the carotid artery and the jugular vein, all of those things travel together in what's called the carotid sheath. And if your upper neck, especially C1 and 2 vertebrae, are unstable or they're chronically tight, that space can get really crowded and cause that cervical instability, which doesn't always make the bones grow, but can, but it also can change the angles of which the bones are at. And it could put pressure on the nerve and the vessels. And this is where people will notice more of the dizziness. Some people will have problems swallowing. They'll feel like something's stuck in their throat, or they have a lump in the throat. They feel like a constant edge feeling in their throat. If you've had whiplash or a neck injury or conditions like Ehlers-Danlos syndrome, these are something to be aware of. And we'll talk about some neck-friendly habits a little bit later. But these are all things that can affect that vagus nerve since it runs right along the side of the neck here. Now, if anyone has had any kind of neck surgery, especially, neck or belly, actually, if you've had gallbladder surgery or if you've had neck surgery, the vagus nerve can actually be affected by these things. So we'll talk about a couple of common ones that can affect the nerves. If you've had a thyroid surgery or a parathyroid surgery, these operations and surgeons work very close to the branches of the vagus nerve that control your voice and swallowing. And you can get temporary hoarseness or trouble swallowing. That's pretty common. And most people will improve over the course of a few weeks or months. But sometimes that vagus nerve can be affected. It could be nicked, or it could be affected in a way that it never quite bounces back. So knowing that somebody's had neck surgery, and if they've developed some of these problems, it's important to do vagus nerve stimulation. Stomach surgeries like hiatal hernia repairs, gallbladder issues, any kind of external stomach things, not like a scope in the throat, that wouldn't do it, but any type of external stomach issues could be an issue because the vagus nerve trunks at the esophagus. And if the nerve gets stretched or irritated, then stomach emptying can change some of the digestion process, and it can cause the digestive process to be slower, which can cause bloating. And some people can get quicker transit time and loose stools, where other people can get slower transit time and constipation. We'll talk a little bit more about gallbladder in a minute too, but it changes the way the bile flow times and what happens. So instead of getting a slow drip, you get a dump. And that dump then changes the way your digestion is, which then directly affects that communication from the digestion back up to the vagus nerve. Even in people who've had groin hernia repairs, this is far from the vagus nerve, so it doesn't directly affect it, but the stress of the surgery and the anesthesia can still tilt the nervous system just temporarily. And the key is knowing what to watch for and when to start to stimulate that vagus nerve. So with gallbladder surgery, it's super common. Hundreds of thousands of people get this done a year. Most people don't know how it actually affects the vagus nerve and the digestion, but the vagus nerve helps coordinate when your gallbladder squeezes the bile into your gut. So normally when you eat fatty meal, your gallbladder contracts and releases a burst of bile to help digest the fat. When the gallbladder is gone, the bile drips continuously from your liver into your intestines instead of coordinating bursts. And your body adapts to this over time. But during that transition, which can take weeks to months, you might notice bloating, loose stools, or trouble with fatty or greasy foods. And some people will even develop food sensitivities that they didn't have before. So it's key to eat smaller meals, chew your food really well, choose warm and simple foods during recovery, and consider digestive enzymes or bile salts if you've talked to your doctor about it beforehand. But most people adjust pretty well to this. Some people will get what's called dumping syndrome, which can also then affect the vagus nerve as well. So good news for anyone who's had or facing groin hernia surgery. It doesn't directly touch the vagus nerve. It's way too far. But again, any surgery or anesthesia can tilt that balance and make you feel more anxious. And as your gut changes, you can sleep poorly, have bad habits after surgery, which is very normal, and your nervous system takes time to recalibrate. So, doing that breathing exercise, the calming tools that we're going to talk about in a second here, will help you rebalance that system quicker and recover from a surgical procedure. So, again, even though the surgery doesn't affect the vagus nerve, supporting the nervous system is really beneficial. Okay, let's talk about devices. So there are a couple of different devices that are available for consumers that help stimulate the vagus nerve. And we get asked about them all the time. So here's my take on how they can be helpful, but they're also not magic. So think of them like a toothbrush. Small, regular use works best, and they work alongside other good habits. So if you skip the deep breathing and the sleep work, the connection and the movement, the device alone isn't going to fix everything. But if you're doing the basics and you want an extra tool, or you need something to help calm you down a little bit faster or a little bit more, then these devices are really a boost. Now, I will tell you, I have seen some of these devices do incredible things. I've seen people get off all of their medication, antidepressants, anti-anxieties, medications for ADHD, a ton of supplements. So they can be extremely helpful, even without doing all of the things that we've talked about, but they can be even better if we do all of the different things. So let's talk about the Truvaga. Is a consumer wellness device made by a company called electroCore, the same company that makes a medical device for headaches. It delivers a gentle electrical stimulation to the vagus nerve in your neck. People can use it for stress and sleep support. Your sessions are short, just a few minutes, and you follow the instructions in the manual. You'll feel a light tingling sensation that's normal and expected, but it should never hurt. If it does, turn it down or stop. Now, safety is really important. If you have an implanted pacemaker or defibrillator, you cannot use this device. It can interfere with those. If you're pregnant or have any heart rhythm issues, check with your doctor first. Sometimes it can disrupt this. If the position is also important as a wellness tool, not as a medical treatment. So it's available without a prescription. But like I said, it works best when it's paired with the other breathing and sleep habits that we talked about today. So let's talk about GammaCore. GammaCore is a prescription strength version of the cervical vagus nerve stimulation. It's FDA cleared specifically for treating migraines and cluster headaches, not for general stress or sleep. But we mention it here because it has a strong clinical evidence and multiple randomized controlled trials showing that it's stimulating the vagus nerve in the neck. It can have a really measurable effect on pain and other symptoms. Truvaga and other wellness devices use similar principles, and they're stimulating the same nerve, but they're positioned for stress and sleep support, not medical treatment. So if you have a severe debilitating headache, this is something to talk to your doctor about, and it may be covered by insurance for the right indications. So the reason I'm showing you both of these is that you understand the spectrum. There's medical grade evidence for the pathway, and there's also consumer tools. I've seen both of them work beautifully for the same thing. So it's not like you have to use the GammaCore or the Truvaga is not going to work. The Truvaga can work really well. The GammaCore really is just positioned more for migraines and headaches. But again, it works on the same thing to stimulate that vagus nerve. Okay, so let's talk about these ear clips. You might have seen devices that clip onto your ear or look like little earbuds. These are called auricular TVNS, transcutaneous vagus nerve stimulation, and they stimulate a small branch of the vagus nerve that runs through the ear canal and the outer ear. And remember that ear cough reflex we talked about a few minutes ago? That same branch works in these little ear clips. So sessions last about 10 to 30 minutes. Some of these are consumer wellness devices, others are medical devices in Europe. The sensation should be comfortable, like a gentle tingle or a pulse. Again, if it hurts, turn it down or stop it. Protocols vary a lot by device, so follow the manufacturer's instructions. And the research on these is still growing. but it's still mixed. Some studies show benefits for heart rate variability, mood, and certain conditions, while others show minimal effects. And they're generally safe for most people, but the same precautions apply. Avoid if you have implanted devices, check with your doctor if you're pregnant or have heart issues. Now let's talk about Pulsetto. This is a consumer neckband, and then they have this little pendant as well that you can just place on the middle of your chest. They both stimulate the vagus nerve through the skin or your neck, and people use it as part of their calming sleep routines, maybe 10 to 20 minutes before bed or during a stressful day. Like all the other devices, it's worked best when paired with good habits. It's not a replacement for those habits. So follow the maker's manufacturer's instructions. And again, same thing, can't use it with implanted devices or pregnancy. The key with any of these devices is really consistency, and it's about the routine. So you can see, like, some people want a quick device. The Truvagas, 2 minutes on each side. Pulsetto looks like a set of headphones, actually, that just lays on the neck. It's 10 to 20 minutes. Your other devices can be 10 to 30 minutes. So if you want something quick and easy, Truvaga. If you want something you don't have to hang on to, you can do different things with it. Pulsetto might be a nice option for you, but they're all going to basically do the same things. So before we move on, we've talked a lot about this already, but I just want to go over this again, is the safety. No implanted pacemaker or defibrillator. Don't use if there's electrical vagus nerve stimulators that can interfere with those devices. Really be cautious. These problems can be serious. Pregnancy, we don't have any data on. People haven't used it in pregnancy. If you have arrhythmias or atrial fib, heart blockage, definitely want to talk to your doctor about using these devices, because it can change the way the heart rate rhythm is, and that can cause problems for people. The sensation should always be comfortable, just a light tingle, never pain. Mild skin redness might happen, or you might get a little tingling afterwards when you're done. That can happen too, and it's usually fine. It should go away in 10 to 20 minutes. But if something just feels off, or the skin feels like it's burning, the redness is sticking around, check with the manufacturer, get instructions, find out what's going on. Most people don't have these kinds of issues, but if you have a mast cell issue, you might trigger a little inflammatory response at the skin level. So we talked a little bit earlier about the reset tool of the cold face. So it's called Cold Face Reset. And you basically get the ice pack, or you can do a bag of frozen peas, or even just some cold water splashing on your face. Apply it to your forehead and cheeks for 30 to 60 seconds. This triggers that diving reflex we talked about earlier, and your body thinks you're going underwater, so it automatically slows the heart rate to conserve the oxygen. This is really well for panic attacks, anxiety spikes, or if your heart is racing, or you just need to calm down quickly. This is one of the reasons people do cold plunges, or they do the 2-minute cold shower trick at the end of their shower. Just turn the water on cold and let it go on their whole body for 30 to 60 seconds and then hop out. This is a very strong response. It can work really, really nicely, especially if you're watching a horrible thing on the news, or a YouTube video that's making you upset, or you're seeing something on social media that's gotten you upset, and now you're trying to calm down and go to sleep. Just go in, splash your face with some cold water. It will reset you and let you get back to sleep. The gold standard for activating the vagus nerve is that slow, controlled breathing. You can do it 2 ways. Option 1 is a 4-7-8 technique. Breathe in through your nose for 4 counts, hold it for 7, and then exhale through your mouth for 8. You can do that 3 to 5 times. Or option 2 would be just begin breathing slowly, about 5 to 6 breaths per minute for about 5 to 10 minutes. Either way, the key is long, slow exhales. That's what tells your vagus nerve we're safe. And when you exhale slowly, your heart rate drops, and that's called respiratory sinus arrhythmia. And it's a sign of good vagal tone. Over a few weeks of daily practice, just 5 to 10 minutes a day, most people see their heart rate variability improve. It's free, it's portable, you can do it anywhere. You can do it during the commercials, do it at the stop signs, like we're supposed to do Kegel exercises and all that fun stuff. It's really foundational for you. And if you get nothing else from that, I would say this deep breathing exercise is key to stimulating that vagus nerve. Okay, this one feels a little silly, but it works. So you can hum, gargle, or sing for a minute or two. Feel that vibration in the throat and the face. And those throat muscles, your larynx, your vocal cords, are wired to the vagus nerve. So when you activate them, you send a calm signal up to your brain. And this is a great pre-sleep downshift for a quick reset before a stressful meeting. Or if you don't need to be loud or good at singing, just gentle. You don't have to belt out those high notes. It can just be a gentle enough singing that stimulates that vibration in the throat. Some people like to hum, or they may om, like in yoga or meditation, they'll om or just hum a tune they like. That works really well. Gargling with water works really well too. It's the same throat activation. You can try it for 1 to 2 minutes. If you're going to try the gargling trick or the humming trick, make sure you're taking a break, like not for 1 to 2 minutes continuously. That's too long at one time. But, do a couple of seconds, 5, 10 seconds, take a nice deep breath, rest a second, and then do it again. Again, it's simple, it's free, and it's surprisingly effective. Now, your nervous system is designed to co-regulate, to borrow calm from safe people. This is why therapy works and why support groups work and why being around calm people helps us feel calmer. If you've ever been around an anxious, nervous person or somebody who's truly like hyperactive, you kind of feel yourself getting racy and jittery. And then when you're around calm people, you're like, oh, I'm really calm. Even if there's a difficult thing, everybody's calm. We can make this work. So a simple practice is to spend 1 minute making soft eye contact with someone you trust. Nod, use a warm tone of voice, maybe put a hand on their shoulder. You're not trying to fix anything or talk about anything heavy. You're just being present together. Even if you have somebody that's kind of anxious and worked up, walking over to them, taking a deep breath, putting your hand on their shoulder, breathing with them a little bit, you'll find that that brings them down as well. If you've ever worked with kids, a lot of these techniques of calming kids down are the same kind of techniques we're trying to do for ourselves as well. Your voice and your face are safety speakers to your vagus nerve. So when you see a calm, friendly face, even your own, it sends a signal that you're safe. This is especially powerful for people who've experienced trauma or isolation. That safe connection is truly medicine for them. So we talked a little bit about your vagus nerve running right next to the big blood vessels in your neck. So neck-friendly habits are really important here. They matter. Here's what to do to keep your posture tall. Imagine a string pulling the top of your head toward the ceiling, and turn your head gently. Don't crank it or force it. Just turn it very gently, and avoid extreme neck stretches or adjustments unless you're working with a professional who understands the anatomy. You can do light self-massage along the sides of your neck, just gently soothing or stroking or deep pressure. Pressure points are really good in this area. If you have that cervical instability, that history with neck injuries or conditions like Ehlers-Danlos work with a physical therapist or a chiropractor who knows how to protect the vagus nerve and the blood vessels. The goal is space and softness in the neck, not to force the neck into a position it's not ready to be in. So here's your assignment. Here's your plan. I want you to start simple and build every week. Every morning, do a 30-second cold face splash. Every evening, do your deep breathing, either the 4-7-8 or a 5-10 breathing before bed. Hum for 1 to 2 minutes, and that's it. Just hum. 3 tiny little habits. And if you're using a device, add those sessions in and add 1 minute of co-regulation daily with eye contact with someone that's safe, a soft smile in the mirror. Track 3 things: your sleep quality, your mood, and that 0 to 10 calm score. So 0 would be totally calm, 10 would be, can't take it anymore. You don't need a fancy app. You just need a simple notebook or a note on your phone or a piece of paper, and just consistently check those beats of intensity. One small action every day is enough. And you can download a free tracker if you want to. There's a bunch of different heart rate variability trackers that we can look at, but all of these small habits really help. So let me tell you where most people mess up so you don't do that. The pitfall number 1 is we go too hard and too fast. We try to do 30 minutes of breathing on one day, and then we hate it and we don't have time, and so we quit. So the solution to that is to start with 2 minutes, make it so easy you can't fail. Pitfall number 2, they skip the basics. They buy a device and they expect it to fix everything without changing their sleep, their breathing, or their stress level. Pair the device with a habit you already do, like brushing your teeth or making coffee. Pitfall number 3 is they use the device in isolation instead of stacking it with breathing or bedtime routines. So do your breathing first, then use your device, or use your device while you're doing the slow breathing so you can kill 2 birds with 1 stone. Stacking your habits are going to make it way easier and automatic to do. So this is all for education, of course. It's not for medical advice, but I want you to be clear when you should call your doctor if you're doing some of these things and you have a severe or sudden problem. First of all, if you have a sudden voice change, you have trouble swallowing, choking, fainting spells, chest pain, blood in your stool, or unexplained weight loss, call your doctor right away. These can be signs that something serious is going on and it needs evaluation. Also, if you try these tools and you feel worse, you feel more anxious, more disassociated, or you feel stuck, stop and talk to a professional. For some people, especially those with complex trauma, their nervous system work needs to be done with a therapist who can help them stay on track within your window of tolerance. So trust your gut. If something feels off, get it checked out, listen to your body. Your body is smart. You just need to listen to it. So here's what I want you to do right now. First, I want you to set your 2-week plan. How are you going to do that? What are you going to do? Kind of think about the day, like when can I fit this into my day so it doesn't feel like another thing we have to do. And if you're listening to this outside of our support call, because it will be posted on YouTube, then like and just share or subscribe if you need to. Third, I want you to pick one tool: cold face, breathing, humming, or co-regulation, and try it tonight. Just try a simple exercise. And then we'd love to hear how it worked for you. So just let us know if you're struggling with anything or having problems with it. So with that, I'm going to stop my screen and we can do